What causes varicose veins, and are they hereditary?
The commonest cause for varicose veins is hereditary. Between 70 to 80% of people who have varicose veins, they will have a positive family history for that. Although we haven't identified a gene specific for varicose veins, there's no question that in the vast majority of people it is hereditary. Now, having said that, there are a number of people who present without any positive family history. Therefore, there is a small group of people that develop varicose veins for no obvious cause, what we might call idiopathic. And then there are other causes that have been identified, typically pregnancy. Now, in pregnancy, in the majority of people, it is not a cause, it is a trigger. That is, varicose veins were meant to develop and they just came earlier. But in a small percentage of people, pregnancy certainly is a cause, and we see a number of people with multiple pregnancies who present with varicose veins. There are associations with increase in weight, and there has been some associations with sedentary professions, although those I would consider to be very loose associations and not real causes. There's absolutely no evidence that standing for any length of time causes varicose veins. Similarly, we have no evidence to suggest that crossing legs or wearing high heels causes varicose veins. These are myths that permeated over the years and they keep being repeated, and that's why they're still around, but there's absolutely no evidence for any of those.
Are all varicose veins visible bulges?
Long-standing varicose veins will bulge and they will be visible on simple clinical examination. However, when varicose veins develop at an early stage, they may not be visible on clinical examination, but they will be visible on using ultrasound, and they will have abnormal flow on ultrasound.
What will happen if I don't treat my varicose veins?
In the majority of people, varicose veins are purely a cosmetic issue. Approximately 20% of people will have either symptoms or develop potential complications relating to their varicose veins. The commonest symptoms associated with varicose veins are those of pain, cramping, heavy legs, restless leg syndrome, even a degree of itching. And generally, some people just feel tired, particularly towards the end of the day, and therefore they instinctively elevate the legs when they get a chance and they get some relief. In a small percentage of people, they can get a more significant problem from their varicose veins, such as bleeding from the varicose vein, and in some cases can be severe enough where it requires a blood transfusion. Some people get thrombosis within the varicose veins, what is known as superficial thrombophlebitis, and I have certainly seen a small number of people who, through a superficial thrombophlebitis, develop a deep vein thrombosis, which is a more serious condition. And typically, varicose veins have been associated with leg ulcers.
Is it possible to treat veins with support stockings, drugs or tablets?
Compression hosiery, such as various types of support stockings, have been used and are still being used to manage varicose veins. You're not exactly treating the varicose veins, but you're managing the varicose veins, so you're primarily dealing with the symptoms that relate to the varicose veins. Similarly, horse chestnut can be used to deal with some of the cramping that people get relating to varicose veins, but none of those will actually treat the varicose veins in any effective way, in that they will still be visible, whether you're wearing the stockings and then they're being removed, and certainly they will still be visible taking any homeopathic medication.
What is EVLA?
EVLA, which stands for endovenous laser ablation therapy, is a relatively new, minimally invasive technique for treating varicose veins. It is, if you like, a keyhole technique whereby we insert under local anesthetic a laser fiber in the offending vein, and then following a handful of injections of local anesthetic in the leg, we fire up the laser and slowly pull it back. And as we do that, the laser fiber seals off the vein at its tip, and then the laser fiber comes out. And the vein is being treated without having to do the conventional operation of cutting the groin or behind the knee and stripping the vein out.
What is the difference between EVLA and stripping?
Stripping is the technique that we have used for many decades, where we basically strip out the offending vein. It is, if you like, a fairly invasive surgery, which involves a cut in the groin in most cases, in some instances a cut behind the knee, to disconnect the offending vein from its junction, and then we pass a a plastic fine tube through it, which comes out at the bottom of the leg, and then we tie the vein to the plastic tube and literally strip it out. This has now been superseded by new technologies such as EVLA or endovenous laser ablation therapy, which is a minimal invasive technique. It doesn't involve a cut in the groin. Stripping is an operation that is done under general anesthetic typically. On the other hand, EVLA or endovenous laser ablation therapy is a minimal invasive technique, which in most cases we do under local anesthetic.
What is the difference between stripping and phlebectomy?
Stripping is a technique whereby we remove or strip out the main vein. That main vein, of course, has a number of branches or tributary veins. In order to give the best possible cosmetic result, we also treat the tributary veins. And the way to treat the tributary veins is by a technique that's called phlebectomy or microphlebectomy, essentially where we use a needle to puncture the skin over the lumpy veins and use a very fine instrument called a hook to pull them out. So we use phlebectomies both when we were doing the conventional stripping operation, but we also use phlebectomies when we're doing the endovenous laser ablation therapy, and that is purely to give us the best possible cosmetic result.
Can vein surgery be done under local anaesthetic?
Minimal invasive vein surgery, such as endovenous laser ablation therapy with or without phlebectomies, can be done under local anaesthetic, and indeed most patients we treat are under local anesthesia. Conventional stripping operation is not advisable to be done under local anesthetic. It would be quite uncomfortable for the patient, and those typically are done under general anesthetic in a hospital environment.
How can someone manage without their veins? If they remove them or close them, where will the blood go?
The blood that typically drains off the leg back into the main circulation goes to the deep veins. Those are the veins that run inside the muscle. Over 90% of that blood will be drained through those veins. About 10% of the blood will be drained through the superficial veins. You, in effect, can never run out of superficial veins, and the superficial veins that we are treating are the varicose veins, which are already abnormal veins. Therefore, they are actually counterproductive to the circulation of the venous blood in the leg. Indeed, by treating those varicose veins, the circulation, the overall circulation in the leg will be much improved.
Why do varicose veins come back after treatment?
People who present with varicose veins in the first place is because obviously they are predisposed to varicose veins. Therefore, when you treat patients with varicose veins, there is always a small risk of those veins recurring, or indeed, if the procedure was incomplete, that those veins redevelop. Now, with the old stripping operation, it is true to say that there was an inherent problem with the technique whereby the veins in a number of people would have been incompletely treated, and therefore after a few years they would come back with recurrent or indeed new varicose veins. It is also true to say that with the new techniques such as endovenous laser ablation therapy, the treatment that the patient receives is more complete, and therefore the risk or the chance of the veins coming back is significantly reduced. There is also another concept which involves, there's also another concept which deals with a condition known as neovascularization, which is whereby new veins form where an incision was made. And typically with the old technique of an incision in the groin or behind the knee, we would see a number of patients over the years that would develop new veins in that area, which then would become varicose and cause more varicose veins in the leg. Now, because we're not performing any formal incisions with these new technologies, such as endovenous laser ablation therapy, that incidence of neovascularization is again reduced, and therefore the risk of varicose veins coming back is reduced. And typically we're looking at a recurrence incidence, that is to say veins coming back following endovenous laser ablation therapy, in the order of possibly 1 to maybe 2% per year, worst case scenario, whereas with conventional stripping, we're looking at an incidence of between 4 to 6% per year of the veins coming back.
If I have had my veins stripped and they come back, can you help?
The answer is yes. There are a number of reasons why veins that have been previously stripped, they have come back. One of the commonest reasons that I see in my practice is that the vein has been incompletely stripped, therefore a large segment of the vein is still there that needs to be treated. Or indeed, the vein that was that the vein was part of what you call a duplicate system. Therefore, there were two veins that were in that same vicinity causing a problem. One has been stripped, the other one has been left behind, which over the years becomes varicose. And of course, in some cases, we find that the veins have been indeed properly stripped, and you get new veins that present over a course of time. The veins that actually have been partly stripped, then endovenous laser ablation therapy would be an excellent technique to deal with those. In people where the vein has been indeed completely stripped and there's no longer a straight segment of vein, then other techniques such as ultrasound-guided foam sclerotherapy or isolated microphlebectomies might be a good treatment.
Will I be able to walk after treatment?
You are encouraged to walk straight away, and indeed you are encouraged to walk for approximately 20 minutes 4 times a day for the first 2 weeks following the treatment.
How long before my legs recover?
Symptomatic improvement will be evident within a few days to a week. The bruising related to the procedure would have subsided within 6 to 8 weeks, and therefore the full cosmetic effect of the procedure would be visible by then.